Hello dear students, today I will explain about Parkinson disease treatment. Parkinsonism is a progressive neurological disorder of muscle movement, which is correlated with destruction of the dopaminergic neurons, and it is characterized by tremors, muscle rigidity, bradykinesia, which is slowness in initiating and carrying out voluntary movements, and also postural and gait abnormalities. Because symptoms of Parkinson's disease reflect an imbalance between excitatory cholinergic neurons and the number of inhibitory dopaminergic neurons, treating this disease is aimed at restoring dopamine in the basal ganglia and antagonizing the excitatory effect of the cholinergic neurons. But the currently available drugs offer only temporary relief from the symptoms of this disease. Starting with levodopa and carbidopa, which is a very common used combination. Levodopa is a metabolic precursor of dopamine and it is actively transported to the central nervous system while it is converted there to dopamine in the brain. Carbidopa is dopa decarboxylase inhibitor and it prevents the metabolism of levodopa in the gastrointestinal tract and peripheral tissue. Thereby, it increases the availability of this levodopa to the central nervous system. So, levodopa in combination with carbidopa is a very potent and efficacious drug regimen which is currently available to treat Parkinson's disease symptoms. The next drugs are Selegiline and rasagiline. These drugs, they selectively inhibit monoamine oxidase type B. This enzyme is, of course, metabolized dopamine, and these drugs, they enhance the action of levodopa when these drugs are administered together. So, Selegiline and rasagiline substantially reduce the required dose of levodopa. Entacapone and tolcapone are catechol-O-methyltransferase inhibitors and they increase the central uptake of levodopa, leading to greater concentration of brain dopamine. Both of these agents have been demonstrated to reduce the symptoms of wearing off phenomenon. Bromocriptine is an ergot derivative, while pramipexole is newer non-ergot drug. Both of these drugs are dopamine receptor agonists and they have longer duration of action and they showed effectiveness in patients exhibiting fluctuation in their response to levodopa. Amantadine is an antiviral drug which has antiparkinsonism action by increasing the release of dopamine, blocking cholinergic receptors, and inhibiting the NMDA type of glutamate receptors. Compared to levodopa, this drug it is less efficacious and tolerance develops more readily, but it has fewer side effects. As I said in the start of the lecture, and treating this Parkinson disease is either by increasing the level of dopamine or decreasing the level of cholinergic neurons. That's why the next drugs, Benztropine and trihexyphenidyl, are also used because they are antimuscarinic agents and they block cholinergic receptors. And these drugs, they are much less efficacious than levodopa and they only play adjuvant role in antiparkinson therapy. Thank you for watching.